The Family Feud studio maintained its established atmosphere of controlled energy on that January afternoon in 2025. Steve Harvey occupied his position at center stage, attired in a tailored navy suit, prepared to facilitate another episode through the format that had sustained the program's success across multiple seasons. The studio audience had been seated according to standard protocol, production personnel monitored their respective equipment stations, and two families stood ready at their designated podiums for what all participants anticipated would constitute another routine taping session. However, the subsequent 20 minutes would produce a confession so unexpected and problematic that Steve Harvey would make the unprecedented decision to immediately cut to commercial break, removing the situation from live observation while determining how to address circumstances that had moved far beyond the parameters of family entertainment programming. For those encountering this content initially, engagement through subscription would be appreciated, as the following account demonstrates the complexity that emerges when personal crisis intersects with public platforms and the leadership required to navigate such situations with appropriate consideration for all affected parties. The Westbrook family from Phoenix, Arizona, occupied one contestant podium. The family unit consisted of 41-year-old Patricia Westbrook, her husband of 16 years, 43-year-old Daniel Westbrook, their teenage daughter who was 14 years of age, and Patricia's sister who had traveled from California to participate. The Westbrooks presented as a professionally successful couple whose external circumstances suggested financial stability and social achievement. Daniel maintained employment as a senior accountant with a regional firm, having advanced through consistent performance over a career spanning nearly 2 decades. Patricia had established herself within the healthcare sector, working as a physician assistant in emergency medicine, a role that required both clinical expertise and capacity to function effectively under pressure. The initial introduction segment had proceeded according to established format, with Steve Harvey engaging in standard dialogue regarding the family's background and current circumstances. Daniel had responded to questions about his professional activities with apparent confidence, describing his work in terms that emphasized analytical capability and attention to detail. Patricia had participated appropriately in these exchanges, discussing her emergency medicine work and the satisfaction derived from providing acute care to patients during medical crises. Observable indicators suggested a functional family unit enjoying the opportunity to participate in nationally broadcast entertainment programming. What remained imperceptible through external observation was that Patricia Westbrook had been experiencing a profound personal crisis that had reached critical intensity in the weeks preceding this taping. The crisis involved neither infidelity nor deception directed at her spouse, but rather a pattern of professional misconduct that had been developing over the preceding 18 months, and that had recently produced consequences Patricia could no longer manage through continued concealment. The psychological burden of this situation had created internal pressure that would manifest through confession, delivered in circumstances entirely inappropriate for such disclosure. The professional misconduct involved substance misuse that had developed from what Patricia had initially characterized to herself as legitimate pain management. Approximately 2 years prior, Patricia had sustained a back injury during a recreational activity that had produced chronic pain inadequately controlled through over-the-counter medications and physical therapy. Her position within emergency medicine had provided access to prescription pain medications, and she had begun diverting small quantities of controlled substances for personal use, convincing herself this represented reasonable self-care rather than problematic behavior requiring intervention. The pattern had escalated gradually but substantially over 18 months. Patricia's tolerance had increased, requiring higher doses to achieve equivalent pain relief and eventually to prevent withdrawal symptoms that had become a consequence of physical dependence. Her diversion of medications had expanded in scope and frequency, creating inventory discrepancies that had eventually triggered investigation by hospital pharmacy oversight. 3 weeks before the Family Feud taping, Patricia had been confronted by hospital administration regarding documented irregularities in controlled substance management within her clinical area. The confrontation had initiated a formal investigation process that Patricia understood would likely result in suspension of her medical license, termination of her employment, and potential criminal prosecution for drug diversion. She had been placed on administrative leave pending investigation completion, a change in her employment status that she had not yet disclosed to her husband or family members. She had been continuing to leave home each day, as though reporting for work, spending those hours in various public locations while managing the terror and shame of her situation in isolation. The Family Feud appearance had been scheduled several months earlier, during a period when Patricia's substance use had been ongoing, but before the formal investigation had commenced. When the taping date approached, Patricia had recognized that canceling would require explanation she was unprepared to provide. She had decided to proceed with the appearance while managing overwhelming anxiety about her undisclosed circumstances and uncertain future. The decision to participate while carrying such significant concealed stress had been questionable judgment that would contribute to what subsequently occurred. The game had advanced through multiple rounds with apparently standard participation. The Westbrook family had performed adequately in terms of providing appropriate answers to survey questions and accumulating points sufficient to remain competitive. Steve Harvey had facilitated normal entertaining interactions, generating audience response through his characteristic reactions and observational humor. Surface presentation suggested routine game show proceedings without indication of crisis brewing beneath composed exteriors. However, as the competition continued, the psychological pressure Patricia was experiencing intensified rather than dissipated. The performance of normalcy, while knowing her professional career was collapsing, and her family remained unaware, created cognitive dissonance that became increasingly difficult to manage. The presence of her daughter, who took pride in her mother's medical career and remained ignorant of the circumstances threatening to destroy that identity, intensified Patricia's awareness of impending revelations that would alter her family's understanding of her character and choices. During what should have been a straightforward question and answer exchange in the fourth round, something fundamental shifted in Patricia's capacity to maintain composure. The question had asked contestants to name something people do when they are stressed, a topic that intersected directly with Patricia's current psychological state in ways that apparently triggered an overwhelming compulsion toward disclosure. Rather than providing a simple survey-appropriate answer, Patricia responded with information that immediately transformed the studio environment from entertainment venue to crisis situation. When I am stressed, I take pain medications that I have been stealing from the hospital where I work. I am a physician assistant who has been diverting controlled substances for my own use for 18 months. I am currently under investigation and will probably lose my medical license, lose my job, and potentially face criminal charges. My husband does not know. My daughter does not know. I have been lying to everyone about where I go during the day because I am actually on administrative leave and can no longer work while the investigation proceeds. The confession emerged in a manner suggesting psychological breaking point rather than calculated decision. Patricia's voice had accelerated during the disclosure, the words tumbling out with quality indicating release of pressure that had become unbearable. The studio environment underwent immediate transformation as participants processed what had just occurred. Steve Harvey's face registered shock that progressed rapidly toward concern as the implications of the confession became clear. Daniel Westbrook's expression showed he was struggling to comprehend information that fundamentally contradicted his understanding of his wife's current circumstances. Their daughter displayed confusion, appropriate to incomplete understanding of adult situations, but sufficient awareness to recognize something serious had occurred. The studio audience sat in stunned silence, recognizing they had witnessed something far outside normal programming parameters. Steve Harvey responded with immediate decisiveness that reflected recognition of the gravity of what had just transpired. Rather than attempting to continue with game show proceedings or addressing the confession directly in the moment, he made an instantaneous decision to remove the situation from continued public observation. "We are going to take a commercial break right now," Steve announced. His tone conveying this was not a suggestion, but an immediate necessity. He signaled urgently to production staff while walking quickly toward the Westbrook family podium, creating physical barrier between the family and the audience as production personnel began clearing the studio. The decision to cut to commercial represented appropriate crisis management under circumstances that had moved far beyond entertainment context. Steve Harvey recognized that whatever was occurring with Patricia Westbrook required privacy, professional intervention, and careful handling rather than continued broadcast to a studio audience. The commercial break provided necessary space to remove audience members, halt recording, and assess what resources and responses the situation required. Once the studio had been cleared and recording equipment deactivated, Steve Harvey approached Patricia with concern evident in his demeanor. "Patricia, are you all right? What just happened here?" His questions reflected genuine worry rather than performative interest, acknowledging that Patricia's confession suggested someone experiencing significant distress. Patricia's response indicated she was experiencing psychological crisis, characterized by overwhelming emotion and impaired judgment. She was crying intensely, her body language suggesting collapse of the composure she had been maintaining through force of will. Daniel Westbrook was attempting to process information that had just fundamentally altered his understanding of his wife's circumstances and behavior. "You have been stealing drugs from the hospital. You are under investigation. You have been lying about going to work. How is this possible? How long has this been happening?" His questions reflected the confusion and betrayal characteristic of discovering that someone close has been maintaining significant deception. Patricia attempted to respond, but was too emotionally overwhelmed to formulate coherent explanation. Steve Harvey made additional immediate decisions regarding how to address the situation. He instructed production staff to contact mental health professionals who could provide crisis intervention services. He arranged for the family to be moved to a private area away from the studio environment. He ensured that Patricia's daughter was provided with age-appropriate support from staff members trained in working with minors during family crises. The decisive actions reflected leadership oriented toward addressing human needs rather than entertainment production priorities. The subsequent hours involved coordination of multiple forms of support and intervention. Mental health professionals met with Patricia to assess her immediate psychological state and her need for psychiatric hospitalization versus outpatient crisis management. Addiction specialists were consulted to evaluate Patricia's substance use patterns and to recommend appropriate treatment interventions. Legal counsel was identified to advise Patricia regarding her rights and options in relation to the workplace investigation and potential criminal exposure. Marriage counselors were suggested to help Daniel and Patricia navigate the relational implications of the deception and the circumstances that had produced it. Patricia was evaluated and determined not to require immediate psychiatric hospitalization, but to need intensive outpatient treatment for substance use disorder, combined with mental health support for the depression and anxiety that had contributed to and resulted from her situation. She was referred to a comprehensive addiction treatment program that specialized in healthcare professionals dealing with substance misuse, recognizing that her case involved both clinical addiction and professional consequences requiring specialized intervention approaches. Daniel Westbrook participated in family sessions designed to help spouses of individuals with substance use disorders understand addiction as a medical condition, while also processing legitimate anger and hurt about deception that had accompanied the substance use. The therapeutic work acknowledged the complexity of his position, recognizing both that Patricia's addiction was not a character failure requiring moral condemnation, and that his trust had been violated through 18 months of lying, requiring rebuilding through demonstrated changed behavior over time. The confession's public nature created complications beyond those that would have existed had Patricia disclosed her situation privately. The fact that television production staff, studio audience members, and eventually viewing public would have knowledge of Patricia's circumstances created additional layers of shame and exposure that complicated her treatment and recovery. However, mental health professionals noted that the public confession also eliminated Patricia's capacity to continue minimizing or denying her situation, forcing confrontation with reality that might ultimately serve her long-term recovery despite the immediate distress it created. The production company faced significant decisions regarding the footage that had been recorded. Patricia's confession had been captured on camera before Steve Harvey cut to commercial, creating questions about whether that footage could ethically be broadcast given the mental health crisis it documented and the potential legal implications of the content. After consultation with legal advisors and ethics experts, the decision was made not to air any portion of the episode, recognizing that broadcasting Patricia's confession would constitute exploitation of someone experiencing mental health crisis and could potentially complicate her legal situation regarding the workplace investigation. However, the production company did create educational content for Steve Harvey's talk show that addressed healthcare worker substance use disorders, the phenomenon of drug diversion in medical settings, and the importance of intervention and treatment rather than purely punitive responses to healthcare professionals struggling with addiction. The content served public education purposes without exploiting Patricia's specific situation, providing information that could benefit others facing similar circumstances without violating the Westbrook family's privacy. Patricia Westbrook entered intensive outpatient addiction treatment within 1 week of the Family Feud incident. The treatment program involved daily group therapy, individual counseling, psychiatric medication management for co-occurring depression and anxiety, and education about addiction neurobiology and recovery strategies. The specialized program for healthcare professionals addressed the unique challenges faced by medical workers dealing with substance use, including access to medications, professional consequences and licensing issues, and the psychological impact of having violated professional ethics while struggling with medical condition. The workplace investigation proceeded to completion, resulting in findings that Patricia had diverted controlled substances over an 18-month period in quantities that confirmed substance use disorder rather than simple diversion for distribution purposes. The hospital administration, in consultation with legal counsel, made the decision to terminate Patricia's employment, but not to pursue criminal prosecution, recognizing that her entry into addiction treatment and the inevitable loss of her medical license constituted consequences appropriate to circumstances characterized by addiction rather than criminal enterprise. Patricia's medical licensing board initiated their own investigation, resulting in suspension of her physician assistant license pending completion of treatment and demonstration of sustained recovery. The licensing board established conditions for potential future license reinstatement, including completion of addiction treatment, maintenance of documented sobriety for minimum specified duration, participation in professional monitoring program, and successful completion of education regarding professional boundaries and ethical obligations. The pathway to potential license restoration was difficult but not impossible, providing hope that recovery could eventually enable return to clinical practice under appropriate supervision and monitoring. The impact on Patricia's family was substantial and multifaceted. Daniel struggled with complex emotions, including anger about the deception, fear regarding their financial future given the loss of Patricia's income, and concern about Patricia's health and well-being. The marriage experienced significant strain during the initial months following disclosure, with Daniel questioning whether trust could be rebuilt and whether the relationship could survive such fundamental betrayal. However, participation in family therapy and education about addiction as disease process helped Daniel develop more nuanced understanding that allowed for both accountability regarding Patricia's choices and compassion regarding the illness that had driven those choices. Patricia's daughter required substantial support to process the revelation about her mother's situation. The therapeutic work helped her understand addiction in age-appropriate terms, distinguishing between the disease of addiction and her mother's fundamental character, while also acknowledging legitimate hurt about having been deceived. The family work focused on rebuilding trust through demonstrated honesty and changed behavior over time, recognizing that healing would be a gradual process requiring sustained effort from all family members. 6 months following the confession, Patricia had completed intensive outpatient treatment, and had transitioned to continuing care consisting of weekly therapy, regular participation in peer support groups, and ongoing psychiatric medication management. She had maintained documented sobriety throughout this period, demonstrating commitment to recovery through consistent engagement with treatment recommendations and support structures. The work had involved not only addressing the substance use, but also examining the underlying factors that had contributed to her vulnerability to addiction, including perfectionism, difficulty asking for help, and tendency to minimize problems until they reached crisis proportions. Patricia participated in a confidential conversation with Steve Harvey approximately 8 months after the confession, a discussion that was not broadcast, but that provided closure for both individuals regarding the incident. Patricia expressed gratitude for Steve's immediate action to provide privacy and support, rather than exploiting her crisis for entertainment purposes. She acknowledged that her public confession had been the result of psychological breaking point, rather than conscious decision, and that while the public nature of the disclosure had created additional complications, it had also eliminated her capacity to continue denial and avoidance that had prevented her from seeking help earlier. Steve Harvey expressed his perspective that the incident had reinforced his understanding of the responsibility that accompanies platform and influence. He noted that Patricia's confession had presented a choice between treating the moment as dramatic content for broadcast versus recognizing it as human crisis requiring intervention and support. His decision to immediately cut to commercial and to refuse to air the footage reflected values that prioritized human dignity over entertainment value, even when doing so meant forfeiting compelling television content that would likely have generated substantial viewership. The educational content developed for Steve Harvey's talk show addressed healthcare worker substance use as broader phenomenon affecting substantial numbers of medical professionals. Addiction medicine experts discussed the occupational risk factors that made healthcare workers vulnerable to substance use disorders, including access to medications, high-stress work environments, and professional culture that sometimes stigmatized acknowledgement of personal struggles. The content emphasized that healthcare workers experiencing addiction required treatment and support rather than purely punitive responses, and that recovery was possible with appropriate intervention and monitoring. The conversation also addressed the broader issue of how people respond when witnessing someone in crisis, particularly when that crisis occurs in public settings. Mental health professionals discussed the importance of prioritizing immediate welfare over curiosity or entertainment value, creating space for privacy when someone is clearly experiencing distress, and connecting individuals in crisis with appropriate resources rather than simply observing or recording their difficulties. The guidance provided practical framework for bystander intervention that could be applied across various contexts where people might witness others in psychological distress. As this account reaches conclusion, several significant lessons merit consideration. Patricia Westbrook's public confession of professional misconduct and substance use disorder represented psychological breaking point rather than considered judgment regarding appropriate disclosure context. Her circumstances illustrated how carrying secrets creates internal pressure that can result in impulsive revelation delivered without adequate consideration of setting or consequences, potentially creating additional complications beyond those inherent to the underlying situation requiring disclosure. Steve Harvey's immediate decision to cut to commercial demonstrated leadership that prioritized human welfare over entertainment production, recognizing that Patricia's confession indicated crisis requiring intervention rather than content appropriate for broadcast. His subsequent refusal to air the footage and his facilitation of appropriate support resources reflected ethical framework that maintained human dignity as paramount value, even when doing so meant sacrificing compelling television content. The situation highlighted the prevalence of substance use disorders among healthcare professionals and the importance of treatment oriented rather than purely punitive responses to medical workers struggling with addiction. Patricia's case illustrated that healthcare workers face unique occupational risks regarding substance use, while also demonstrating that recovery is achievable through comprehensive treatment, addressing both the addiction and the professional and relational consequences that accompany it. For those who have engaged with this account, subscription to this content channel would be appreciated, as these narratives regarding human crisis, appropriate intervention, and paths toward recovery serve important educational purposes. Patricia Westbrook's shocking confession and Steve Harvey's immediate response will be remembered not as entertainment, but as illustration of how crisis can emerge unexpectedly in any context, and how leadership in such moments requires immediate prioritization of human needs over all other considerations, creating space for privacy, dignity, and connection to appropriate support, rather than exploitation of distress for public consumption or commercial gain.